Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Paige Quintero, who is a bariatric surgeon, and that's a weight loss surgeon.
Yes.
Thanks for coming in.
Thank you.
Now, January, everybody's resolution is to lose weight. How do we know if we need to lose weight? Is there a definition of obesity, or just a little bit heavy, or terribly heavy? How do you know?
I think back in the day we would say kind of general terms like, well, I'm overweight or I need to lose a few pounds, but now we actually have categories. So we can relate a person's weight to their height. So weight over height squared in metric is body mass index, BMI. So a BMI of greater than 30 is considered obese. And then there's classes. There's class 1 obesity, class 2, that's BMI 35 to 39.9, class 3, BMI 40 and greater. So we can get a little more information than we used to about if a person's weight is healthy or not.
Well, you mentioned that. So if it's not healthy, there's things you can do about it. So where do you start?
So I think it matters kind of how much you have to lose. You know, if you've got a little bit of weight to lose, you may be able to make some lifestyle changes, like change your diet, do some exercise. You may be able to get where you want to go. If you've got more weight to lose, some people are really benefiting from some of the weight loss medicines that we have now.
Okay, now you mentioned that the injectables are just exploded on the scene. So tell us a little bit about that.
So the injectable weight loss medicines, our medical term for them is glucagon-like 1 peptide agonists, or GLP-1s, are medicines that come in a shot form, and they're given either daily or weekly, and they decrease hunger, they increase the feeling of fullness, and they also are making metabolic changes, like they're decreasing insulin resistance. These drugs originally started as drugs for type 2 diabetics, but we realized they had a side effect, weight loss. And so now we actually have them branded and indicated for weight loss, even in non-diabetic patients.
But it's not as easy as just, okay, I'm going to take a shot and lose weight, is it?
Absolutely not. Absolutely not. I tell patients that weight loss has 2 components. There's the part that we can give you medically or surgically. We can turn down hunger. We can turn down cravings. We can make you feel full. But then there's the part that the patient brings to the process, which is getting educated, what's the right thing to eat, what kind of exercise should I do, getting organized and getting focused. But what's great about the medical and surgical interventions that we have is it kind of takes away what makes you not focused, which is hunger and cravings. So we can blunt that and people can have good success.
Now the medicine does that, but it is a medicine and there are potential side effects. I mean, you should just take it willy-nilly.
Absolutely not. I'm a big believer in patients being educated on the risks and benefits of whatever therapy they're going to have. So any patient who's going to start this drug really needs to have a good conversation with their doctor about what's good about it, what's not good about it. Usually the side effects of these drugs are GI side effects, nausea, feeling full, maybe vomiting, abdominal pain, that kind of a thing. And for a lot of them, they will ebb over time, but they are still there, so you want to make sure that you talk with your doctor about that. And then this is not really a side effect, but you want to choose the right patient to prescribe this drug to. These drugs are expensive, and if you've got good insurance coverage, you're very fortunate. But whatever a person does to lose weight, they need to keep doing to keep it off. So at this point in time, these drugs probably are going to be something someone has to take long term. And that's okay. I mean, obesity is a chronic disease. So of course, it's going to be with you your whole life. You do need to suppress it, but is the patient going to have insurance coverage for this drug long term? Can they afford it? Is it going to be safe for this particular patient long term? So those are the questions that your doctor needs to answer.
Now, you mentioned medicines, but real quickly, you also are a surgeon, so
Yes.
there are surgical procedures for obesity.
Yes. So I would say the most popular procedure in America and also in our practice is the laparoscopic sleeve gastrectomy. And that's a very simple procedure. We just remove 85% of your stomach and you lose a ton of weight. When we decide surgery versus medicine, and that's a decision that the patient has to make, and sometimes it's molded by what is their BMI, what is their insurance going to pay for, but sometimes it's how much do you need to lose. So if you need to lose, 30 pounds, maybe medicines are going to be great. If you need to lose 100 pounds, maybe surgery is more what will get you to your goal.
Well, it sure is interesting information, New Year's resolution. We appreciate the information you give us. Maybe it will help some folks lose some weight.
Thank you very much.
We'll be right back.